About hypertension, and the first thing we're going to talk about is pregnancy-induced hypertension. So that is 2 occurrences of elevated blood pressure of 140/90 on a pregnant woman. That's after 20 weeks.
And with that, there shouldn't be any signs of preeclampsia, no proteinuria or any other preeclampsia signs. One of the other types of hypertension in pregnancy would be chronic hypertension, which is any hypertension that existed before the pregnancy, before 20 weeks. And like pregnancy-induced hypertension, that won't have any signs of preeclampsia, though having chronic hypertension can increase the risk of preeclampsia. So next is preeclampsia.
Oh, preeclampsia. What about it?
So preeclampsia is different than pregnancy-induced hypertension in that it also has 2 separate occasions of blood pressure, 140/90 or more, but there will also be other signs of CNS distress. So they might have right upper quadrant pain, headache, they might have proteinuria, and you really have to assess their CNS for any problems, their extraocular movements,
they may have clonus.
They may have clonus, they may have hyperactive reflexes because
Nystagmus.
they're having CNS irritation from the hypertension. And
if that progresses and gets worse, you can go into eclampsia, where the patient is actually having the seizures. So then that becomes a medical emergency. So the first thing you want to do is probably assess them, then probably give them magnesium sulfate so that you can decrease the occurrence of seizures.
Mm-hmm. Normal seizure precautions for eclampsia. And then the most serious progression of preeclampsia or even eclampsia would be HELP syndrome. And HELP syndrome stands for hemolysis of red blood cells, elevated liver enzymes, low platelets, and this is really a big emergency because at this point the hypertension and the preeclampsia has progressed to the point where there's low platelets and there are going to be clotting problems. There's going to be bleeding risk, infection risk, all sorts of things. So this, if it progresses to HELP, it might be a point where they need to do an emergency C-section or induced labor.
Positive.
All right.